This is a special time that the COVID-19 is affecting the world, and that's why the casual edition here. So we have this problem we call Quervain Tenosynovitis, or it's also known as mother's thumb. I guess it could be daddy's thumb as well. Basically, it could happen to a lot of mothers, but also a lot of people, if we text using our phones and stuff like that, you could overuse this. So just a bit of basic anatomy. Our thumb has 3 tendons, but 2 of the major one here forms we call anatomical snuff box, because when you flex your thumb here, you see there's a little groove. People used to snuff using that, okay? But we have this tendon called APL, which is Abductor Pollicis Longus, and the one next to it is called Extensor Pollicis Brevis, so you'll be EPB. So basically these 2 tendons are the usual one that has trouble. So in our wrist here, there is a sheath. Just think about there's a wrapping going around it. So imagine I got a sheath and my rope is underneath. When it moves, there's a little bit of a friction. Normally the tendon moves smoothly, it's fine. But if you overdo it, it could create inflammation. So therefore, when the tendon trying to move, it hurts. So basically, whenever you lift up your thumb this way, it will pull the tendon in here, and that could cause pain. There are a couple of reasons why we call it mother's thumb, because I guess with a newborn, you're doing a lot of like giving baths, so you pick up the baby, or sometimes when you breastfeed, your hand is bent in that position a lot. So whenever you overuse those, you'll give you pain. But also in the last stage of pregnancy, our body have these hormone called relaxin. Relaxin basically makes your ligaments to be a bit more stretchy, so it's easier for labor. So there's theories that show that if these ligaments in our hand and wrist and fingers are more elastic because of the relaxin, it's not as stable. So the muscle might have to overuse it to try to compensate for this laxity, and therefore it could load the muscles and cause pain. So the basic 2 tests you could do to try to see if that's the problem. One is really just if you touch those tendons, if you touch it, it probably hurts. The other way is if you press it and try to lift your thumb, either up this way or we go up to the sky, it will hurt. That tells you about that local pain in the tendon. Or the other way we call it Finkelstein Test is if you put your thumb down, if I put it down, wrap it, and if I go down this way, okay, so I'll go closer. If you go down, you will stretch these tendons and it actually going to cause pain. So those 2 tests are more specific to tell you that's the problem. Most commonly, we want to stretch these tendons to help them. But when it's very, very sore, actually to stretch it might actually hurt it more. So there are recommendations of wearing, we have these we call thumb Spica splint. I'll try to put a picture. Basically, you wear a splint that has a little hole, and then there's a little bit of a plastic or metal piece that keep your thumb up. So that will keep the tendon more relaxed, because if you stretch down, it's gonna hurt, okay? Or the other way is if you wear like a wrist brace, when your wrist cannot move, it's better, but mainly it's the thumb motion. So we have these thumb Spica splint. People could wear that to protect it. However, when you have to use your hands a lot caring for the baby, doing housework, it's very inconvenient. So a lot of people don't use it, so the compliance rate is actually low. The other option is some people will get a cortisone injection into your region here, which could help. However, we talk about after pregnancy, you have that laxity. So if you add some cortisone, maybe it's not the best thing. And I would definitely leave that as last resort. Other tips is that when you have that very sore stage, obviously if you could cut down the repetitive motion with the typing and the texting, that would be great. You could try some voice dictation these days instead of typing, or go to a keyboard or something like that. So for the new mom and dad, it's a bit harder to not use your hand because you gotta care for your baby, right? But in between time, if they're napping, just rest your hand. Don't try to do a lot of hand work. If you can, you want to rest it because you want to decrease the load that's on your tissue to help it. So one tip for breastfeeding is usually if we hold the baby up a lot like this, you can see your thumb tendons are usually working very hard, and that loads it. So if you take a nursing pillow and then put it underneath and rest it there, so your weight is actually rested on the pillow, okay? So this is a bit thin, but anyway, if we double it up, we go like that, okay? And then this hand here, you're still holding the baby's head. If you can, maybe use your other bicep to hold it. So the key is to make sure your thumb is not working hard and try to kind of relax your thumb a bit so you don't stick it out this way, okay? So in that case, it decreases the load on that. Now, for giving bath, I guess usually we're more bent down. And if we're picking up baby from the bath or diaper changing, your hand is very bent down like this. You can see that loads it quite a bit. So try to bend your body more, use your core and keep your wrist straight. You can see my wrist is more straight to pick up the baby this way instead of doing a lot of that, right? And then so if you pick up, don't try to use all your wrist motion. Once I reach down, hold the baby, try to use your bicep more to lift, to decrease the load on the thumbs, okay? So some people might take some medication to help it. So Advil has more anti-inflammatory properties. However, I guess if you're breastfeeding, obviously we try to avoid any medication. Some people might take Tylenol, which is a bit milder, but it just helps with pain rather than helping inflammation as much. Some people could use these anti-inflammatory rub, such as like Voltaren and EmuGel to rub locally on those tendons, and you could like massage it in, okay? That could help you to bring down the swelling locally. But like I talked about, if in the initial stage, if it hurts so much, you don't want to do that, right? Because that might flare. So instead of stretching the tendon here, we could work on your muscles. So there are 3 main groups of muscle that you could use, okay? So the thumb muscles here, that does those motion, okay? We call them extension and abduction, okay? So 2 ways. They actually come from your forearm. So if you take your hand and put your finger on it, okay, and I want you to move your thumb, you could actually feel those tendon that kind of glides underneath here. So you could use your hand to find the one that moves, and I want you to massage it, okay? So I'm using my finger. I could try to massage it this way, but you could also try to massage it that way. So the idea is to find that tendon. It's closer to this end rather than here, okay? So just move those. Do both your thumb going up to the sky to feel that. Also, like I showed you, you could do like away from the palm like that to massage that. So that's those muscles attached to the tendon go to the thumb. So if you could relax it here, you'll help that. So that's first group of muscle. Second group of muscles, if you think about, we have these, we call them thenar muscles and adductor muscles. So these muscles, they basically, they prevent your, if they're here, they prevent your thumb from going out, right? So if it's too tight, it's gonna resist these. So you're gonna take your finger and I want you to massage it. So I'm gonna take my hand and go in and try to massage them. So I could pinpoint just by pushing into my muscle, pinpoint them, okay? You could do them in this area. Also at the back of your hand here, you could also do it. So I will use my hand to show you. So you can pinch it to massage it. So you could simply relax these muscles so they will allow an easier motion to go that way, okay? So the third group of muscle we call the pronators. It goes from the arm up. So mainly pronate, meaning if I put my hand here, you could actually turn it down, okay? Like turn it down. So again, if that's tight, it's gonna load those tendons. So you're gonna go to closer to your elbow, okay? You're gonna try to find the muscle, and when you spin your hand, you'll feel that muscle, and I want you to massage that, okay? So you could do this on a table, like resting on the table to push it. You don't have to do it in free air. Or some people use like a, like a massage stick or highlighter or something. You could push it down and try to massage it as well, okay? I will work on each of those muscles, maybe like a couple minutes. You could do this when you're watching TV or something like that. You wanna massage it, maybe cause a little bit of discomfort, but don't hurt it too much, okay? If you want, you can put some heat on it to relax the muscle before you actually do these massage. Okay, so after that initial really inflamed sore stage, you do those massages. When you're better, you can start to do some stretches. We're gonna do gentler stretch first. So if you just take your thumb and go across, you could actually stretch that, okay? So you could do that, there, and do a few times to feel the stretch, okay? So that's the first direction. Okay, so the second stretch, we have this motion we call the abductor. They actually move your thumb this way. So if I show you this direction, it could actually go like down and up. Okay, so it's kind of like your thumb moving in the plane of your palm. You're gonna go that way, all right? Versus this way, it's like this, right? Okay, so gonna do that way. That's the second direction. So once you get the thumb stretches better, you could do some wrist stretch as well. So if I just take my wrist and if I bend down, okay? You could do like that. I'll show you from this angle. So basically, I just keep my thumb there and I could bend down. It stretches these guys. When you're better, you could put your thumb out first and then do the stretch. You will go like that, okay? So that mainly will stretch these. Some people also like to do it the other way as well, just as a opposite direction of it. So then now we're gonna go the other direction. Basically, we're gonna go from here and go down that way, okay? So we'll start with the thumb on top. When you get better, you can cross it and stretch that way, okay? And again, some people like to go the opposite way, which is going up to the sky to have the opposite direction stretch and motion as well. So like the Finkelstein, if you put your finger into it, if you go down, you can stretch it. Okay, so after the stretching phase, when you are much better, I would say if you could have zero pain or a tiny bit of pain, then you're gonna do some strengthening. So the easiest way is to use a rubber band. So I would basically put a rubber band around here. So if my palm is like this, I just use a thin one to show you. You could use a bit of thicker one, but if my palm is like this, you're gonna go out that way, hold, 5-second hold, and come on back in, okay? So that will work on one muscle. And the other way, when I was trying to show, if your palm is like this, it could go up towards the sky. So that will build those two particular muscles and tendons that we talk about, okay? So you do 5-second hold. So you could do 2 sets of 10 repetitions, okay? If it's too much, if you start to fatigue out, just cut it short. Don't try to make that many repetitions, okay? So after those 2 rubber band exercise, you should do a bit of flexor, which we use the ball, and simply you could just squeeze the ball together, okay? So I'm using all my finger to squeeze in at the same time, or if you want, you could start to work on thumb towards my index, then my middle, my ring, and my pinky. So I'm gonna go like that way, okay? When I get better, I gotta move the other way, then the other way, then the other way. I have another video that focuses on all the finger and thumb strengthening exercises. You could do those as well. So in final summary, you talk about the management of the Quervain Tenosynovitis. I would say in the early stage, you want to splint it, you want to rest it, decrease the use. Then you go on to the first stage using the massage of the tendon, okay, to calm it down. Then we move on to the stretching. And then the final stage is when you do the strengthening. But also remember to try to reduce the load on your wrist and thumbs.